Assalamu alaikum. My name is Mohammed Haris, Group GMM15. Now today we discussion about the uh, drug affecting blood. Blood is is a specialized body fluid. It has four main components: plasma, red blood cells, white blood cells, and platelets. Blood has many different functions, including first, transporting oxygen and nutrients to the lungs and tissue. Second, forming blood clots to prevent excess blood loss. Third, carrying cells and antibodies that fight infections. Bringing waste products to the kidney and liver, which filter and clean the blood. Regulating body temperature. There are two circulation pathway. First of all, intrinsic pathway and extrinsic pathway. Extrinsic pathway start when damaged vessels and when damaged by cells in blood coming factors, three tissue factors and activated seven factor and four factors in a calcium ion. And second, intrinsic pathway. Intrinsic pathway work then damage inside of vessels, vendining and endothelium vessels, endothelium cells of vessels, activated inductors such as collagen, ATP, and activated cascade plasma factors. Cascade plasma factors of enzymatic reactions that ultimately result in the conversion of fibrinogen to fibrin monomers. Fibrin monomers are then cross-linked into insoluble standards that serve to stabilize the loose platelet clot formed in primary homeostasis. In this way, they are formed cloth and normal conditions in our have plasminogen plas- plasma enzyme plasminogen activated when are activated into formation after formation cloth and plasminogen convert to plasma and plasmin while splitting will excess of cloth splitting into di so-called dimer. D-dimer means D-dimer. And second purpose, there are fraxipyrine, hyperine, xeritol. Xeritol, they are acting by directly inhibiting two activated factors, so-called thrombine, and 10 activated factors, active so-called steward probably factors. In this way, stop circulation. Mechanism action of steptase and aminase. Steptase, streptokinesis, aminase traplases. Aminase traplases is a thrombolytic drug that is also known as anisolated plasminogen. Streptokinase and nestraplase, a modified congener of streptokinase. Steptase, streptokinase, aminase, anisotraplases act by plasminogen to produce an activator complex that converts plasminogen to proteolytic enzyme plasmin. Streptokinase is an extracellular protein extracted from certain of beta hemolytic streptococcus bacteria. And again, we have extrinsic pathway and intrinsic pathway. Streptokinesis. Parenteral dose 1.5 million international unit, half-life 18 minutes. Aminase 13 units parenteral and half-life 90 to 105 minutes. Treatment of anemia, folic acid, vitamin B12, mechanism action of ferrous sulfate, ferrous gluconate, antigra iron combines with porphyrin and globin chain to form hemoglobin, which is critical for oxygen delivery from the lung to other tissue. Iron deficiency cause a microcytic anemia due to the formation of small erythrocyte which insufficient hemoglobin. Description: the concentration of hemoglobin HGB result 91.0 unit of measurement G over L gram over liter. Normal MAPA 120.00 to 140.00. Now we discuss about folate cycle. Folate cycle central among in its important function in delivery of one carbon unit of methine cycle, methionine cycle. Mechanism action of fluoride acid B12 and B6 is taking part in the folate cycle. What is folate cycle? Folate cycle start hemocysteinia by taking folic acid, vitamin B12 and vitamin B6 and specific enzymes so called 5-methylene tetrahydrofolate and tetrahydrofolate and methine methionine transverse reductions MTR methionine transverse reduction and homocysteine convert methionine convert by taking ATP is S-adenosylmethionine with will multiply RNA and DNA not working without multiplication and the deficiency of vitamin B12 and vitamin B6 it's very serious problem because we all dissolve disease for a folate acid cycle and decrease multiplication in this way DNA and RNA not working then block synthesis of new cycles deficiency lead of hyperhomocystinemia Hyperhomocystinemia can lead to blood formation and thrombosis of cardiac vessels and other different vessels in our brain. These one lead to the insulin and infants. Folic acid external dose per internal dose 200 mcg 400 mcg half-life 2 hours. Ferrous sulfate, ferrous gluconate, internal dose and external dose. Ferrous sulfate, external 163 to 5 milligram and half-life 6 hours. Or ferrous gluconate 225 to 325 half-life 6 hours. Platelet function disorder. There are several disorders of the blood platelets that lead to bleeding problems. For example, immunothrombocytopenic purpura ITP. A patient platelets may be less able to stick to the blood vessels wall to plug an injury. Most platelet function disorders are mild, but some can lead to severe bleeding. Hemophilia. People with hemophilia have reduced level of specific plasma clotting factors in their blood. The disorder is usually inherited and it affects only males. Approximately 20,000 men in USA have hemophilia. There are two forms, TA hemophilia and TB hemophilia. TA hemophilia reduce factors 8 and B hemophilia reduce factor 9. Treatment of hemophilia Novo 8 anti-hemophilic factor 8 parenteral dose 500 to 3000 international unit powder and solvent for solution for injection half-life 7.5 7.7 to 9.1 hours factor 9 recombinant RX brand name and Rexobix parenteral dose 250 international unit 500,000 1500 international unit Lyo Felizide 2000 international unit powder for reconstructions to have a half-life. FFP fresh frozen plasma parenteral dose 45-70 milligram over milliliter as human plasma protein 10 to 20 ml over kg of body weight half-life 3 to 10 days.